Welcome to Healthy Care, your trusted source for vital health information and well-being. Today, we're shedding light on a topic that remains one of the biggest health challenges worldwide: cancer. It's a silent enemy, often creeping in unnoticed until it's advanced, making early detection absolutely crucial. Many people believe that cancer develops suddenly, but in reality, your body sends signals long before the disease takes hold. These warning signs are often subtle, easy to dismiss, and mistaken for minor health issues. But what if recognizing them early could change everything? What if a simple awareness of these symptoms could lead to timely diagnosis, better treatment outcomes, and even save lives? Cancer isn't just a single disease. It's a group of complex conditions caused by uncontrolled cell growth, disrupting the body's natural balance. While some risk factors are beyond our control, knowledge is a powerful shield in the fight against cancer. When you listen to your body and act early, you give yourself the best chance at prevention, treatment, and recovery. In today's video, we'll uncover 10 overlooked symptoms that could be warning signs of cancer, symptoms that many people ignore. Our goal is to equip you with the knowledge to protect yourself and your loved ones. Because at Healthy Care, we believe that awareness, prevention, and early action are the most powerful tools in safeguarding your health. So, stay with us, pay close attention, and let's take a proactive step toward a healthier future, because your health is your greatest asset. Number 10. Unexplained lumps or changes to the skin. Unusual lumps or changes in your skin are another symptom of cancer. Whether it's a new mole, a change in size or color, or unexplained swelling, these alterations could signal skin cancer or other malignancies. One of the most common reasons for unexplained lumps is the growth of tumors under the skin or within the tissues. Cancerous growths can arise from different types of cells in the body and may present as palpable masses or bumps. You can feel them during self-examination or observe them visually on the skin surface. Cancer cells can spread from their original site to other parts of the body through a process called metastasis. When cancer metastasizes to the skin, it manifests as new lumps or nodules that may feel firm, irregular, or tender to the touch. Some types of cancer cause visible changes in the skin's appearance, texture, or coloration. These changes include the development of new moles, alterations in the size or shape of existing moles, or the emergence of lesions or sores that fail to heal. Skin cancers like melanoma, basal cell carcinoma, or squamous cell carcinoma often show these typical changes, highlighting the need for regular skin checks. When cancer cells spread to the lymphatic system, they cause nearby lymph nodes to swell. These enlarged lymph nodes can be felt as firm lumps under the skin and often signal the body's immune reaction to cancer. Swollen lymph nodes can occur in different areas, such as the neck, armpits, or groin, depending on where the cancer started. Number 9. Indigestion or difficulty swallowing. While occasional indigestion is normal, continuous or worsening symptoms like difficulty swallowing or chronic heartburn could be a warning of something serious, such as cancer. Cancerous tumors in the digestive tract obstruct the normal passage of food and fluids, leading to difficulty in swallowing. This is also known as dysphagia. These tumors may arise in various parts of the digestive system, including the esophagus, stomach, or intestines, and can interfere with the movement of ingested substances. Tumors also interfere with the secretion of digestive enzymes or bile, affecting the breakdown and absorption of nutrients from food. This results in symptoms like bloating, abdominal discomfort, or nausea. Cancer, as told earlier, causes inflammation and ulceration in the lining of the digestive tract, making it painful and difficult to swallow. This inflammation could be due to cancer cells invading tissues directly. Also, sometimes tumors press nearby nerves that control swallowing. This pressure can interfere with the muscle movements needed for swallowing, causing feelings of choking or food blockage in the throat. Number 8. Mouth sores that won't heal. Mouth sores, as you all can vouch for, are torturous. In severe cases, even swallowing your own saliva becomes difficult. It could also be due to smoking, but excessive mouth sores are another symptom of cancer. Cancer disturbs the regular healing process of tissues. When cancer develops in the mouth or throat, it damages the fine lining of these areas. Also, the rapid and uncontrolled growth of cancer cells hinders the body's ability to repair damaged tissues, causing the formation of mouth sores that don't heal. Not only this, but cancer also weakens the body's immune system and its ability to fight infections and help heal wounds. As a result, even minor injuries or irritations in the mouth take longer to heal, leaving behind stubborn sores that stick for weeks or months. If you have ongoing mouth sores that won't heal, especially alongside other worrying symptoms, it's important to see a doctor. Number 7. Blood in urine or stool. Blood in urine or stool should never be ignored. While there are various non-cancerous causes for this symptom, such as hemorrhoids or urinary tract infections, it is also a symptom of more serious conditions like bladder cancer. Cancer cells can harm the tissues in your digestive or urinary system. As these cells grow, they damage blood vessels, causing internal bleeding. This bleeding might not always be visible to the naked eye, but it can manifest as blood in your urine or stool. Also, cancer cells disrupt the normal structure of organs. In some cases, cancerous growths can lead to ulceration or erosion of the lining of the bladder, colon, or rectum. This damage causes bleeding, which mixes with urine or stool. When cancerous tumors grow, they press nearby tissues and blood vessels. Also, tumors of the bladder, colon, or rectum compress blood vessels and rupture them. This causes bleeding, which passes out of your body through urine or stool. Another reason for bleeding is inflammation caused due to cancer. Inflammation weakens the blood vessel walls, resulting in bleeding. If you ever find blood in your urine or stool, even if it's just a small amount, don't ignore it. Even if it's not cancer, it is still alarming. Number 6. A cough or hoarseness that won't go away. A cough or hoarseness that lasts for weeks or months could indicate a respiratory problem like lung cancer. Indeed, coughs are commonly linked to colds or allergies, but it's also important to note it, especially if you have other respiratory symptoms or smoke. Cancer can also lead to a lasting cough or hoarseness that doesn't go away. Let's learn how cancer causes these symptoms in simple terms. One of the most common reasons for a cough or hoarseness is the presence of a tumor in the respiratory system. Cancers of the lungs, throat, or voice box develop tumors that irritate the airways, leading to coughing or changes in voice quality. As a tumor grows in the respiratory tract, it hinders the normal flow of air. This obstruction results in a chronic cough as the body attempts to clear the airways of any blockages. Similarly, if the tumor affects the vocal cords or surrounding structures, it causes hoarseness or changes in voice pitch and tone. Besides, cancerous tumors also initiate inflammation and irritation in the tissues of the respiratory system. This inflammation stimulates cough receptors in the airways, leading to persistent coughing. Also, irritation of the vocal cords or larynx can result in hoarseness that lasts over time. If you experience a cough or hoarseness that lasts for several weeks and doesn't improve with time, it's advisable to consult with your doctor. early detection and treatment of cancer-related symptoms lead to better outcomes and improved quality of life. Number 5. Abnormal bruising. Have you ever seen a bruise on your body and wondered where it came from? Bruises are a common occurrence, especially after minor injuries. But if you're noticing excessive bruising in unusual places or without any apparent cause, it could be a sign of cancer. It happens because some cancers, especially those affecting the blood or bone marrow, interfere with the body's ability to produce clotting factors. These factors are responsible for stopping bleeding and preventing excessive bruising. When cancer disrupts this process, even minor injuries result in larger bruises that take longer to heal. Also, certain cancers, such as leukemia or lymphoma, attack the bone marrow, where platelets are produced. Platelets are tiny blood cells that help form blood clots to stop bleeding. This causes a drop in platelet numbers. With fewer platelets in your blood, you're more likely to bruise and bleed. Besides, cancer directly damages blood vessels or causes abnormalities in the blood vessel walls. This damage weakens the vessels, making them more prone to rupturing and causing bruises. Also, in some cases, cancer may spread to the liver or affect its function. The liver produces proteins necessary for blood clotting. When it is compromised by cancer, clotting factors are reduced, making bruises more common. Number 4. Persistent fatigue. You might have felt tired from time to time, right? But if you experience constant fatigue that doesn't improve with rest, it could also be an alarming sign. After waking up in the morning, you feel completely drained as if you haven't slept at all, even after having a peaceful sleep. This unending fatigue affects your ability to carry out daily activities and impacts your overall quality of life. But did you know that cancer contributes to this overwhelming sense of tiredness? As we discussed earlier, cancer cells are like energy thieves. They steal important nutrients and resources from your healthy cells to fuel their rapid growth and multiplication. As they grow, they consume more body energy and leave you feeling drained and exhausted. Also, as cancer spreads, it disrupts normal bodily functions and metabolic processes. If you don't know, metabolism is the process by which your body converts food into energy. When cancer cells attack this process, they affect the body's ability to produce and utilize energy efficiently, leaving you in a constant state of fatigue. Besides, your immune system works hard to fight these cancer cells. This ongoing struggle exhausts your body, making you feel tired and drained. Number 3. New or unexplained pain. Pain is another way your body signals that something isn't right. We've likely all experienced sudden or unexplained pain in our bodies that seems to come out of nowhere. You might feel a sharp pain in your abdomen, back, or bones for no apparent reason. While many types of pain are harmless, persistent or unexplained pain should always be considered. It could also be a symptom of cancer, especially if it doesn't improve even after taking painkillers. When cancer grows and spreads, it exerts pressure on surrounding tissues, organs, and nerves, leading to discomfort and pain. Also, some tumors release chemicals that irritate nearby nerves, resulting in sensations of pain. The pain can vary in intensity and duration depending on the location and type of cancer. It can range from dull aches to sharp stabbing sensations. Feeling random and sudden pain occasionally is okay, but persistent pain that does not seem to go away could be a red flag for you. Whether it's abdominal pain, headaches, or discomfort elsewhere, it's important not to ignore it and to consult your doctor. Number 2. Constant fever or night sweats. Fever and night sweats are common symptoms of various illnesses, but if they occur regularly, they could be a cause for concern. As we all know, Fever typically symbolizes an immune response to infection or illness, but sometimes they are also subtle signs of a more serious condition, such as cancer. It's because cancer triggers a series of changes in your body's immune system and metabolism. These changes lead to inflammation and disruptions in the body's internal temperature regulation. As cancer cells multiply, they release certain substances such as cytokines. For those who don't know, cytokines are small proteins secreted by immune cells. They act as signaling molecules to regulate immune responses, inflammation, and communication between cells. These molecules induce fever as a response to inflammation. Also, some cancers, particularly lymphomas, directly affect your body's temperature-regulating mechanisms, leading to persistent fever and night sweats. Repeatedly waking up at night soaked in sweat and feverish without any clear reason, if this happens continuously, don't ignore them, as these symptoms could be your body's way of telling you that something isn't quite right. It's important to consult with your doctor and take proper medication. Number 1. Sudden weight loss. Have you recently noticed a sudden drop in your weight without any changes to your diet or exercise routine? While losing a few pounds might seem like a positive thing for some, this sudden weight loss can sometimes be a sneaky sign of hidden health issues, including cancer. Waking up one morning and realizing you've shed a significant amount of weight without even trying may be confusing, but it's important to pay attention to your body's signals. So how does cancer cause sudden weight loss? Cancer cells are like freeloaders at a party and consume a lot of energy as they multiply and spread throughout your body. They hijack nutrients and energy from your healthy cells, making your body work extra hard. Also, some cancers release substances that affect how your body burns energy, causing sudden weight loss. These changes can reduce your body's balance and result in unexpected weight loss. We must always listen to our bodies and never overlook the signals they give us. Paying attention to even the smallest changes can be the key to detecting cancer early, giving you the best chance for successful treatment and recovery. Your health is your most valuable asset, and staying informed can truly make a life-saving difference. Early detection saves lives. If you've noticed any persistent or unusual symptoms, don't hesitate, consult your doctor and take proactive steps toward your well-being. Ignoring these signs won't make them go away, but addressing them early can change everything. Here at Healthy Care, our goal is to empower you with knowledge that protects lives. If you found this video helpful, show your support by giving it a thumbs up, sharing it with your loved ones, and subscribing for more essential health insights. Together, we can raise awareness and create a healthier, more informed world. Stay aware, stay proactive, and most importantly, stay healthy. We'll see you in the next video.